Hello, in today's video we are discussing about prostate cancer and how it can be minimized in our society. Prostate cancer is usually common in men who are above 40 years. Prostate is that gland that plays very vital role in men's reproductive health, and it should be taken good care of. There are some risk factors. Like I mentioned before, men that are 40 years and above. Then family history. In some family, you will hear that it's prostate cancer that killed that person's father or uncle or whomever in the family. Then number 3 risk factor is that of lifestyle of some men. Do you know that this can come gradually, and some it can come acutely and very aggressive? So there are some ways which it can be prevented. Number 1 is, when I say those men 40 years and above, what do they do, or what would they do? What they should do is to make sure that they go to hospital to check their prostate specific antigen, the PSA. The doctor will be able to know whether it is within normal range or it is going higher than it's supposed to go. Some examinations will be done. One of them is that they will put their finger in your anus. Please, you shouldn't hesitate. It's for your own good. Then, the second risk factor is that of family history. How do I mean? If any of your relatives was found out to die of prostate cancer, whether your father, your uncle, or whomever, so that history is there, and you have to take very precautive measures in order to make sure that you don't fall victim. Yes, you can do that. Then lifestyle. Your lifestyle matters a lot. Some people indulge in taking alcohol on daily basis. They forgot that water is the best they should take. I beg of you, make sure that you are taking water as much as possible. 10 is the least. If you are smoking, you try and avoid smoking. Avoid smoking. If you are obese, you make sure that you try and do some exercises that will help you to come down gradually, and you will get yourself better, because obesity is one of the problems. Then as well, if you are the type that loves so much processed food, you try and curtail it. Go to organic food, naturally cooked food. Avoid junk food. How do I mean? Go on leafy green vegetables. Very wonderful. At times you chop onions with tomatoes, you take it, it refreshes your body. Do exercise at least 5 times in a week. Duration 20 minutes to 30 minutes, or as your body can carry. The one you can do, you do, but make sure you're having regular exercise. That will help your lifestyle. You minimize sedentary work. Walk around so that the body will be active at each moment. Then there are some signs it can give you, like pains when you are urinating at your lower abdomen. Sometimes you will see some drops of blood. At times, when you are ejaculating, releasing sperm, you feel pains, either during sex or after sex. All those things are some of the signs. At times, if you are urinating, it will come with force. After, it will just be dropping, ton, 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 ton. You know that there is danger knocking at your door. And you have to run. Run to the hospital, do the necessary tests, take the advice. Even when you do the test and they say it's positive or your PSA is high, please comply with the treatments. Comply with the treatment so that it will be taken good care of on time. So, in conclusion, try and know your age and know what to do. Know about your family history. Thirdly, your lifestyle. It matters a lot. Then when you're having these signs, you make sure that you don't sit and say something must kill man one day. For your own good, for your family, for your children, try and take good care of you. And leave the rest for God. Thanks for watching this video and don't forget to share it. Wow.